Hey everybody, welcome to our mastermind. So we are doing something different today. We're here in person with a few billing companies in Scottsdale, and I'll introduce you guys in a couple of moments. And we also have people joining us from across the country, which is awesome. So to make this a little bit more personal, I'm going to turn on our video here. And so, hey everybody. Okay, so here we are in Scottsdale. Sean, I'm going to turn this to you.
Sure.
We're going to do a little intro. I'm going to have the people that are logged in right now do their intro, and then we'll introduce the people that are in this room.
Okay.
Is that good? Okay.
You want me next to you?
Yeah, sure. I mean, now I'm going to share this. I'm going to share my screen in a second. Okay. Okay, so I just created a few. No. Sharing. What?
Yeah, it's sharing it.
Is no, but it's I need to share my screen. You see my screen? Perfect. Okay, great. Okay, so Jim, you're up first. Just tell us what's on the screen and just a little bit about yourself. Okay, I have to unmute you. Right. Okay. Good point. Let me unmute everybody. Okay, Jim, you're on. Do you want to just tell us? Could you see your screen? He may have to unmute himself too. Okay, let's go to Ramesh. Okay, maybe this is not working out so well. In the meantime, while Jim figures out how to work his computer, Sean, introduce yourself.
Hello, everybody. This is Sean Kanaka. We are based here in Phoenix, Scottsdale, Arizona. Our company name is Unis Link. We provide EMR, revenue cycle management, and healthcare analytics to about 75 practices and close to 500 physicians in the Valley. Some of them are out of town, but majority of them are in the Arizona area. And I'm one of the 3 partners in the company and known Hani for a while.
Okay.
And that's about it, I guess.
Okay, cool. Okay, let's see if I can get Jim to introduce himself, or I can just, Jim, you with us?
Can you hear me now?
Yes, I hear you now. Okay, so could you see your screen? I made a little slide for you so you can tell us just what's on the slide.
Yeah, that is definitely me on the slide a few years ago. Global Health Management, we're out of the Northeast, out of Houston, Pennsylvania. Try to deal as much as we can out in the Northeast, but we do reach out into different states out more towards the West as well. We usually hover between 15 and 25 employees. We're usually also into the specialties of around the ambulatory surgery centers, either the center itself or any of those ambulatory services sitting like anesthesia, orthopedics, general surgery, GI, that sort of deal. Been around for about 20, 21 years, 22, 23 years, somewhere around there. And I think that answers everything that's on that screen there. And, thank you for having me on.
For sure. Okay. I'm going to have Ruth. Here, I'm going to go. I have to unmute everybody, so give me a second. Ruth, you want to tell us a little bit about you? I don't know if Ruth, could you hear me?
Yep, I can now.
Okay. Welcome back. I know Ruth was in India.
Thank you.
Welcome. Just because I want to get to everybody, and so just tell us what's on the screen. Introduce yourself to everybody.
All right, great. Nice to see everybody. We are a small billing company that are located in Tennessee. We specifically bill for physical therapists in private practice. We have about 80 therapists, altogether individual therapists. Some of them are parts of large groups, and some of them are individual practitioners.
Awesome.
And we loved India. It was an awesome trip. It was fantastic.
I know you met with my team. They said really.
That was wonderful. That was so cool. We were really pleased to meet them.
Okay, great. Okay, Ramesh, you're up next. Tell us a little bit about you. I know I'm missing some stuff. The NA is just my team did it, so I apologize, but tell us
Uh,
if you don't
Hey,
have any.
Henny. Can you all hear me?
Yeah, I hear you now.
Thank you. Yes, I'm from Med Strategies, and I'm the person without the goatee right now. So that's the big change between what you see there and me. Um, we are basically located out of the Ashburn, Virginia, which is in the suburbs of Washington, D.C. Have been in business since 2000 and for about 12 years now. Let's put it that way. We use a product called MicroMD, work with, and we also do everything as a value-added reseller. We consider ourselves to be a healthcare IT as well as a revenue cycle management firm. While most of our revenues do come from revenue cycle management, we do a little bit of additional things like EHR, software implementation and support, IT services, and so on. And have about 25 employees with a few more in India too. We primarily use a product called MicroMD, and specialties that we deal with include everything from anesthesia, internal medicine, ambulatory surgery centers, pain management, psychiatry, psychology, neurosurgery, neurology, pediatrics, and so on. And thank you, everyone.
Okay, thanks, Ramesh. Okay, I think Kathy, are you there? Let me just unmute Kathy. Hey, Kathy. I don't know if she's with us. Okay, we may have lost
Hi,
Kathy.
can you hear me?
Hi. Yes, I hear you. How are you?
Hi, good. It's been a while.
Yes, it has. I know I have your slide here somewhere. Hold on, here we are. Okay, so yeah, I apologize for the limited information I have, but go ahead, introduce yourself. I could not find a picture of you, so next time you'll send me.
That's fine. I'm here in Troy, Michigan. My company is a few miles from me right now because I'm not at the office. We've been in Michigan probably for 30 years, servicing multi-specialty, generally physician office-based practices, mostly in the area, although not completely in the area.
Awesome. Okay, and Joseph, do you want to introduce yourself? Let me just put this on. Okay. Let's see if I could do this. And okay. Joseph, you want to introduce yourself to the group?
Yeah, hi. I'm Joseph. You hear me?
Yeah, I hear you.
Yeah, I'm Joseph Tessler. I'm currently Director of Billing of Premium Health Center, as well as have my own private practice. As we specialize in FQHC billing. We currently have about 30 doctors, and we're based out of Brooklyn, New York.
My
I'm working with
hometown.
Sunny.
Perfect. Love
Correct.
it. Okay.
The picture is a little, yeah.
Okay.
We'll let it pass.
All good. You'll send me another one next time. Okay. So what I'm excited about this for this oncoming year of 2019 is I want to have this in-person meeting. So meeting with everybody in person in different states. So we're going to be doing meetings in different states for the year of 2019. We're going to be looking at New York, Colorado, Florida, Texas. And so as soon as we have those dates firmed up, we will send out an invite to the group. It's going to be local for that state, but everybody across the country will be invited to the webinar, similar to how we are doing it now, but we will come to a state near you, so please stay tuned. And if you want to have something in your state, like if you are excited about the idea of getting together with other medical billing companies such as yourself, please shoot me an email and let me know if that's something that you're interested in, and I'll be happy to organize something. And if you're interested in speaking about any specific topic, please reach out to me as well. Okay, I'm going to give this over to Michael right now. Michael is from Practice Max. He's here with Tim. We work together, and Michael has something very exciting.
We introduced you.
Okay, sorry. Yes, Tim, sorry, come here. Good point. And Michael, you too. Why don't we just do this here? Okay, we're gonna move this over here. Okay, so,
Why don't you go over there? They'll see plenty of me or hear plenty of me.
okay,
Hello?
okay. Tim, just tell us,
Hi, my name is Tim Carhu. I'm Vice President at Practice Max. We're a multi-state national RCM company providing A to Z services for healthcare practices. I'm responsible for the payer contracting side of our business as well as the credentialing. And then I've been in this industry for a long time, so I pinch hit here or there as need arises.
okay, awesome. We're so glad to have you here. And that's Michael. Michael's gonna be doing this presentation. So I'm gonna hand this over to you.
Great, thank you.
And let's
I
get
could
started.
actually just present.
Okay, yeah. Okay, let's do that.
I need to turn your speaker off as well. Okay, well, thank you, everybody. As she said, my name is Michael Johnson. I'm with Practice Max, also like Tim. I'm going to share my screen here in a moment, and you should be able to see my presentation. Give me just one moment here. Oh, you know what? Will you pass the presentation to me so that I can do that? I can't yet. While she's starting, while she's doing that, I will do a, perfect. Okay. Sounds good. Let's get started then. So as a background to myself, as you can see here, I'm a vice president at Practice Max, one of several, and most importantly, I'm the fifth of 8 sons. Started my first business at 11 years old, and in a past life won a lot of limbo competitions. That's not the case anymore. Those in the room can attest that I wouldn't qualify for limbo competition any further. But really, a little bit about me. I've been with Practice Max for over 5 years. And what we'll be talking about today as it relates to patient satisfaction is an area within my responsibility at Practice Max. And so we'll talk a little bit about that in a moment. Just a little bit about us. Practice Max has been around in various forms going back to 1969, and we now have offices across the country, New York, Chicago, Nebraska, Texas, Louisiana, a couple of offices in Arizona and Portland. We also have an office. We opened our own office in the Philippines, and so we have an office in a city called Cebu, where we have about 400 employees right now. So we have a lot of specialties, and we've integrated a lot of different providers into our system. But one of the things that is a trend throughout it is, we were talking about this with Sean before the big meeting started. Within RCM, it's very important to provide stickiness to the clients, to create a situation where not only can they get good RCM services, but they have other reasons to stick with you versus another company that could provide them with good RCM services. And so you'll see here what we call the Max 360 difference. We felt like we needed to create a program that built stickiness for our clients. So we provide contracting, coding, claiming, and collecting, which many RCM companies do. But we continued that with what we call the 360 to include things like Max Insight, which is what we'll talk about today, which is data collection, stakeholder feedback, and surveys that we provide. And then Max Intel is our data visualization, our data intelligence system. We offer compliance services. And then Max Pro is a suite of services that really are closely aligned with practice management, includes accounting, HR, marketing services for the practice. And so what we're going to talk about today is really just this Max Insight section within what we call the Practice Max 360. We'll start with Richard Branson. Those of you who are familiar with Virgin Air, Virgin Telephone, Virgin, variety of other things, he's been a very successful entrepreneur and has taken companies and made them successful very quickly. He says this: we know that the best way to drive positive change is to learn from our mistakes and to hear what our customers have to say. Our companies thrive off customer feedback. It helps us to innovate and disrupt and keeps us relevant. You hear this kind of talk a lot in the general marketplace, and particularly where consumers are the main clients, where you're shopping at a Walmart, where you're shopping on Amazon.com, where you're shopping at Nordstrom's. There's a lot of discussion about this customer interaction, but it's becoming more and more apparent. And in fact, several groups recently have talked about how important this is within healthcare. And more companies are recognizing that within healthcare, their patients have choices. Now, not every patient in every situation has a choice, but in most cases, their patients have choices. And it's very important for them to understand how to do a good job. It's really interesting. We work with a lot of groups that deal with hospital bundle payments. In the new bundle payment world, they have to perform well or the hospital's not going to give them the business. And the ability to perform well in many ways can be tracked through listening to your customers. So we're going to talk about that and how, as an industry, healthcare providers are moving and needing to move to where they're getting better feedback and where they're able to use that feedback to improve their practice. What that means for this group is it creates an opportunity to build stickiness. If you can be the provider of those services, if you can offer that information collection and the ability to create a feedback loop with patients, it puts you ahead of most other RCM companies because they're not doing that. You can integrate it. We'll talk in a moment about how we integrate it in several important ways into data that we already have for them, and it really makes it a very powerful relationship. So we're going to talk just for a moment about what providers are facing and what it is that they need to be doing right now to be successful. One of the things that's important is to understand how can they listen? What are the options that a provider has to be able to listen? And by the way, this same principle applies to you as an RCM company. So as we're talking about this, you can think about, what am I doing to listen to my customers? And then what can I do to help my customers listen to their customers? And in that case, it's the patient. So there are kind of three different broad sets of feedback that people get. One is the direct feedback. We'll talk about that in a moment. Online feedback, and then solicitation of feedback, or directly asking for feedback. Direct feedback in a practice is going to happen on site. It's going to happen at the front desk. It's going to happen when a patient calls in, and it's typically going to be one directional. Providers have not been very good at asking for direct feedback in person. They're not asking the questions other than health-related questions, care-related questions, sometimes billing-related questions, but rarely are they very good about asking for direct feedback. And so what you typically have is feedback is biased. Direct feedback is typically coming from the most negative people, the ones who are yelling at the front desk, the ones that are yelling at the biller on the phone. And so direct feedback is often skewed. We don't actually get, and we have a lot of data to prove this. If you just listen to the direct feedback, you're typically getting a skewed result. You're typically getting a worse off picture of the practice, an unrealistic picture of the practice. And so we feel like taking direct feedback is important, but managing it is even more important. Understanding what it means is even more important. So we'll talk about that. Outside of direct feedback, the reality of today is that everybody's getting a tremendous amount of feedback that is outside of their control. Every practice can be rated on these types of sites, right? They can be rated at Google, rate MDs, Health Grades, Vitals, etc. You have no control over that. We manage, for many of our clients, we manage their online presence and their online reputation, and they'll get a negative response on a Yelp. There's nothing they can do to take that down, right? We can't go in and say, dear Yelp, this person's review is invalid because of a unique situation that day. And so what you end up with, again, are people who are motivated to go out and make comments. There are some tricks you can do to motivate your positive customers, but your negative customers are inherently motivated, right? They're the ones that they've got something in their craw and they're upset, and they're going to go and they're going to share it with the world, right? So they're typically the people that are first onto these sites. We do have tools, and there are a lot of companies that offer tools to monitor online reputation health, and then to help you react, because that's one thing you can do on a Yelp or on a Google or on a Health Grades is if they give you a negative response, you can go in and respond back and say, you know, I'm sorry you had that experience. Let me reach out to us. Let us fix it. You know, we can talk about ways that we can improve it. Thank you for the feedback. So there is some things, even with feedback, that's outside of your control. But one of the realities is this outside of your control feedback can often lead to hopelessness, because you may have a provider like this who's a provider who's possibly doing a really good job, and in the last 10 years they've had one person go onto Google and one person left a very negative response. But now every time somebody goes to Google and sees that provider, they see a 1-star rating. So it's out of Dr. Fluck's control. He has no ability to go in and change that Google rating, right? That's the first thought. There are some things, like I said, you can do to encourage positive reviews, and we can talk about that if there's some time at the end. But the reality is what's being posted there, you have no control over. Here is the listing. I think this came from RateMD. No responses. And again, 22 years of practice. Nobody's taken the time to respond. Well, again, what if you have one negative experience? They're going to go on, they're going to give you a negative response. The reality is the same doctor on a different website has a 5-star response, has a 5-star rating on multiple responses. So again, there's just no control over that process. And so it's very difficult to see how you can make headway in really getting meaningful feedback through these online surveys. So what can you do to get meaningful feedback? Providers can do several different things. One is they can certainly create comment cards on site. There are some practices who do that with good results. They can do personal calls, and there are some, again, providers that do that with great success. But one of the things that you can do that's very predictable is surveys. And so we're going to talk today a little bit about how you can use surveys to get important feedback. In the context of a practice, we're going to talk about a couple of different types of surveys. There's customer satisfaction. This is going to be how satisfied, how engaged is the patient with your practice. Another is health plan adherence. And this is something where as a billing company, if you can offer this, this is a big deal. We'll talk about it in a moment. This also leads to things like supporting chronic care management, which creates additional billing services for those providers. So we'll get into that and how you can use surveys to actually support health plans. And then understanding desired services. Many practices could expand their services to their existing clients if they knew what their clients were looking for and ways that they might be interested in being supported. So we'll talk about that briefly again. Let's start with customer satisfaction. The question around customer satisfaction is, what does a provider need to know? We're going to start with this concept. The most important thing, and many studies, our own research studies in other companies, Gallup, many others have done research that says, what you really want to identify is, of your patients, of your clients, who is a promoter of your business? Who is your cheerleaders, your champions? Who's out there to support you and loves what you're doing? Who are your detractors? Who are the people that are going to be making negative comments online? Who are the people that are going to yell and shout at your biller on the phone? And then there's always this group in the middle that are called the passives. It's interesting. You may look at this and say, wait a second. On this scale, there's a whole lot more detractors than there are passives or promoters. That's been studied and studied and studied and found to be true. Unless you really delight somebody, they're not going to give you an 8 or 9 score. They're not going to be your promoter. You have to go above and beyond to do that. In fact, we use on many of our questions, we use a scale that's the expectation scale. So what we may ask is, how were your expectations met for your wait in the waiting room? And what that does is allows people to say whether you met their expectations, whether you fell short of their expectations, or whether you exceeded their expectations. And only those where you're exceeding the expectations will they become your promoters. You have to actually do better than what they thought you would do when they walked in the door. And so that's an important distinction. So one of the areas that everybody should be asking their patients and frankly all their clients is this willingness to recommend. How willing is a patient to recommend you? If they're a detractor, you absolutely want to find out why. How could you improve? What could you fix so that they would be willing to recommend you? If they are a promoter, we actually, in our survey system, we have it set up for many of our clients to where if somebody says they're a promoter, then we actually ask a follow-up question of, are you willing to leave a review on Google or Yelp or Health or Doctors.com or one of the other sites? And then it actually sends them, if they say yes, we have a method to actually push that patient directly to Yelp, to the review page for that provider. So all they have to do at that point is type it in, hit save, and it's already populated. So we can actually use those promoters to generate additional positive comments online. The other area that I think is important to look at are, within a practice, and you would look at the same thing in RCM, is what are the areas that are important to track? I can tell you from our research, the number one most important thing is the provider experience. A patient's experience with the provider. Did they feel like they got their answers or their questions answered? Did they feel like they had enough time with the provider? Did they feel that the provider was honest, was sincere, and cared about their health? If they're answering yes to those items, it is almost certain that they're going to be willing to recommend that provider, even if they have struggles in other areas. And we'll show you in a moment how we use analytics to actually determine for every single practice what is it that's most important for them to improve a willingness to recommend or not. But these are areas that we think every practice should be looking at. What's great about this is if you include questions about billing services and follow-up after, you can get some really good data from the patients of your clients. We have found that where we do that, we can understand better, are people happy with the patient services phone calls that they get? Are they happy with the way the statement reads? Do they understand the statement? Is it clear to them? We could actually improve our billing performance as a result of getting appropriate feedback on the back end. How do you get the feedback? We feel like there's no right answer. Every practice is a little different. For example, when working with an urgent care, there's not necessarily a long-term relationship with that patient. And so a kiosk on site or a tablet on site is a great way to quickly get their information because you may never hear from them again. Other patients that come in regularly, you may have a relationship to where they'll give you their email address, they'll authorize you to send them email content, and you may send them an email after every visit to see how it went, to get kind of a snapshot or a quick what we call rolling score into how they're doing. You can do surveys on your website. You can embed on your website a link, and so patients can go and take a survey anytime they'd like. You can certainly do phone surveys. We still have clients that do paper surveys, and so they send a paper survey in the mail. That's completed, it's sent back to our processing center and loaded into the system. So there's a lot of flexibility, but it really depends on the practice. We have a group, for example, that just recently did a survey. It was a group of anesthesiologists who wanted to know how the different anesthesiologists in the group were performing. So they surveyed the surgeons. It was not a survey of the patient. It was a survey of the surgeons that they were working with because they wanted to know who was capable, who had the skills, who had the demeanor, and who those surgeons were willing to recommend. That came back with great information. In fact, the practice made changes to their provider pool. They actually cut a couple of people out as a result of that because they felt like they were a risk. They weren't providing the type of care that was reflective of the practice and what they wanted to do. So depending on what information you want, what information you're trying to get, it may change the method you use to complete the survey. And so using an experienced researcher, they should be able to help you identify what survey methodology is best. So now you've collected it, and now you have all of this. For those of you who know Star Trek, his name is Data, so that's my little data joke. So now you have all the data. What do you do with it? How do you understand it? How does a practice understand it? And so what we do, and what any good survey company would do, is we take that data and we feed it into a user-friendly dashboard. And this dashboard allows them to very quickly and in many different ways get information about the respondents and how the respondents have reacted. In this case, we're looking at some data from a rehab facility, but what you're able to see here is the willingness to recommend score, how many people are in those top categories. You can see how the staff is doing overall, the care overall, some kind of basic things. We actually have industry benchmarks available for many types of practices and many types of clients. So we can show you how you're doing compared to the industry. We don't have that for all specialties, but we do have for some. And then one of the things that's important is we actually take over in the top right corner. I was moving my mouse and then I just realized you can't see me moving my mouse. But in the top right corner of the screen, you'll see there's some boxes. We actually really encourage open-ended comments, but they become almost impossible to use. If a provider gets 1,000 open-ended comments, what are they going to do with all of that information? So what we do is we have personnel that actually read every comment and code them, and the frequency of the code is represented by the size of the box. So the larger the box, the more frequently that subject came up in those codes. And I'll show you in a moment other ways that we can look at that. One of the most important things is in the bottom left, we do some analysis to actually help you understand what is it about your practice and the other questions we've asked that's driving willingness to recommend. So we do what's called a correlation analysis, and we can determine what is the thing that is most important at either driving that score up or driving that score down. And so if you work on that one area, it's going to be your best bang for the buck. It's going to allow you to improve the most. Another thing that is very important is to be able to, again, we take all those comments. You want to be able to read them, but we actually make it so that by coding them, we can actually split up and you can read those codes, those comments based on what's going on. So if I'm concerned about facility issues, I can click on that and read all the facility issues down below. I don't have to read through kind of all the comments to get there. One thing that I think is really important is we like to, with this survey data, not just take the information from the questions, but we like to tie it into the EHR data. In the EHR, for every patient, you know their address, you know what type of procedure they've had, you know if they came from a referral source. There's a lot of information you have about that person, their age, other demographic information. So in our system, you'll see at the top there are a lot of filters. We like to be able to filter the results of the surveys by provider, so we can determine, is there one provider in the practice that's got a higher score than the other? If they have multiple locations, we can filter it by location. And then what we can do here is we can do things like analyzing the respondents. Here we can look at by zip code. This is in New York. By zip code, we can see where the respondents to the survey are coming from. And so the larger the bubble, the more frequently you're getting responses from that type of a survey. So there's a lot of flexibility in actually tying the EHR data that you already have access to, and hopefully you can put it into some sort of a data warehouse and then tie that into the surveys. When clients work with us, whether it's our own billing clients or whether it's a lot of our survey work, in fact, the majority of our survey work by and large is not our own billing clients. It's a separate line of business that we provide surveys for others. And we'll talk about that in a moment. But we like to get that access to that data because it makes it much more meaningful. It also allows things like literally sorting my results. So I can say, show me the results of everybody who is referred by this hospital or referred by this other provider. I sort the results down to that group, and then I can print that off and walk into that referral source, and I can say, look, last month you referred this many patients. This is how satisfied they are. And hospitals, ACOs, even payers love that. We actually use this in our contracting. Tim can use this to show a payer the satisfaction of the people who are from that payer. So we can break it down and walk into a meeting with Blue Cross for contracting and say, Blue Cross, we've seen this many patients, this is what their satisfaction level is. So it creates opportunities that you may not otherwise have as a billing company if you have this data coming from the patients. Now, we're looking for stickiness, right? We're looking for opportunities to be a value add to our clients. One of the ways you can do this using surveys is actually not in a customer satisfaction survey at all. It's in a health plan adherence survey. So after a patient, particularly one with a chronic condition, after a patient with a chronic condition is seen by the provider, they typically have steps in a plan that they're supposed to follow. If those steps include tracking their weight, if those steps include certain medications that they're supposed to be taking, you can actually build surveys to check up on the patient and get information. So this is a national report that just came out. They said that 50% of chronic patients are happy to take a survey as part of a remote monitoring system, right? Those patients that have diabetes, that have chronic heart conditions, that have other issues that need to be kept up, they are happy to fill out that information because they feel like it helps improve care. Yet only 11% of providers are currently using it. But 92% of providers feel like it would be helpful. That's a massive gap. My guess is your clients are in between the 11% and the 92%, right? They're people who feel like it would be useful, but they haven't had the time and energy to put it together or to go find a company that can offer it. So this is where you can come in and you can offer it. And you can say, look, why don't we help you set up a program to do this create this feedback loop for health plan adherence. One of the great things about this type of a program, the way we build it, you can actually set it up so there's triggers. If they have yeses and nos on certain questions, you can actually alert staff at the practice to say, hey, this person's not taking their medication. And it creates an alert that goes back. Now the practice can get somebody on the phone and call and say, hey, how come you're not taking the medication? Well, maybe it was too expensive. They didn't feel like they could pay for it, or they just forgot, or they just didn't think it was working very well. So anyway, it creates actual health plans. Now, one thing to be aware of, if you're not working with your clients on chronic care management, this type of activity, particularly any follow-up related to this type of activity, can be counted towards chronic care management, and that can be billed out for any patient that has 2 or more chronic conditions and where the practice is their primary healthcare provider. So there's additional revenue to the practice that can be found by building a health plan adherence program and helping the client to participate in that. The types of survey questions are going to be different. It's going to be, do you understand your health plan? Do you have the necessary tools to be successful? For example, do you have a scale if you're supposed to be weighing yourself? Do you have medication that you're supposed to be taking? Do you know how to use those tools? If you're taking your blood pressure, do you know how to do that? If you're doing insulin or if you're checking your blood sugars, do you know how to do that? Are they following the plan? Are they and are the results as you expected? Again, this feedback, if it's being reviewed by staff, can really help to understand the patient and what the next visit ought to encompass. This record can actually be plugged into their health record so that the provider has this information next time they come into the practice. So again, one of the benefits of this is the fact or the ability to be able to use your kind of coming to the table with a solution and saying, here, we have an offering for you to create stickiness with the client. How do you make it stick? How would you go about this? I would imagine most of the people on the call do not have a survey division. They don't have a survey company. They don't have a survey team. And so how could you do it? How could you use the surveys to help your clients? Well, one is to partner with existing companies. There are companies like ours. We certainly are nationwide and do this with a lot of clients and could do this with other RCM companies, but there are others like us. We're not the only one. So partnering with an existing company and saying, we would like to offer this, potentially entering into a reseller agreement where there's actually extra revenue for you as part of this, can help you to create additional stickiness. And then really, if you're providing any dashboards, or even if you're providing just static monthly reports, if you can integrate the survey data into those reports, it makes it so much easier for the provider. So they don't have to be looking in different systems, different places. And so one of the things is make the survey part of the reporting that you're already providing. Then they will always associate it with you. They will always consider you the provider of those services, even if you're actually partnering with a third party to collect the surveys and to build the system. So as far as a recommendation for other RCM companies, certainly that's where I think there's good opportunity, is to partner with somebody who's doing this, who has a system, or you could potentially build it yourself. I'll tell you, it took us some time and energy. We actually bought a survey company 5 years ago so that we could build this program specifically for patients. And I think those of our providers that are participating in it find it very helpful. It's also one of the first things we tell them in our 360 circle. We tell them right off the bat, we offer these solutions, and many of them, that becomes a differentiator, something that they get excited about. So with that, I want to open it up and see if there are questions, if people have thoughts. If people are doing something like this, it would be interesting to get feedback. But certainly if they're not and they're interested in asking questions, we're available to that as well.
Okay, well, could you explain more? Well, that was a great presentation, Michael. I learned a lot, and that's pretty cool. Talk to us more about the reseller agreement. Like, tell us how that works.
So I can only really speak for the way we do it.
Okay.
Like I said, other survey companies, other programs. But the way we do it is we have a package of products, depending on whether it's phone surveys, electronic surveys, paper surveys, email surveys. That package of products is actually, when we resell it, we put it under a different name. It's called Service Track. And so Service Track surveys are made available to your clients, and we can actually provide you with a pricing matrix that you can go in and say, here's the pricing for these services. On a reseller agreement, then there's a percentage of that would go back to you as the seller, as the person negotiating that agreement with the payer. And for larger groups and situations where maybe they're a little bit price sensitive, or they're wanting to do something that's outside of the pricing sheet, we can actually come in representing Service Track. That's why we have this separately branded survey company. We can come in as Service Track, representing you, working with you. We could even be branded as an extension of your organization and go in and help provide those questions. I know there's historically, you don't want to go in with Practice Max and say, here, look, Practice Max has this service. So that's why we do things under the Service Track name. It makes it so that you can go out and sell these services as well.
I would assume you would do this primarily for primary care and telemedicine practices where patient relationships are more important than specialists.
Interestingly, we do this in just about every type of specialty. Here's where specialists need it. Many specialists, depending on what it is, have repeat visits from the same patient. Right. And in those situations, we want to get after the first visit, we want to know what's the likelihood that they're going to come back. Is there something about their first experience that's negative that makes it so that they're not going to come back again? We even do this a lot in ERs and with hospital-based practices, because they are having to justify themselves to the hospital all the time. And so this gives them ammunition to go back to the hospital and say, look, we're doing a good job. The customers are happy with our services. So they may use it for different reasons than a primary care doctor, but we found that for many of them, it's just as important because they use it in their hospital negotiations or in their relationship with the hospital.
When they're negotiating, many specialists, when they're negotiating with insurance companies, there's a sense of, gosh, I'm helpless. I just have to take what they offer. Right. Until you can start to set yourself apart by showing, hey, this is our customer satisfaction. You want your patients going to a provider that has high satisfaction scores, and we can demonstrate that. Now that gives you a talking point for negotiations and a reason.
Otherwise, they have no incentive.
Exactly right.
I think that's brilliant. The part of the contract negotiation is a huge, huge deal because it's so hard to negotiate contracts these days. You need as much ammunition as you can get.
Yes.
So it's wonderful. So I sent out a poll for those of you who are on your computer of how many of you are currently using some kind of polling system. And 25% of you said yes. So for those of you who said yes, does anybody want to talk about what they're currently doing? And if I can't hear you, just send me a message in the chat. And it'd be great if you could
one of us
talk to the group about it.
One of us probably needs to turn our speaker on.
Okay, so I think that's Jim. Jim, you with us? Hold on, let me myself. Jim, could you hear me? Is that you who does this? Oh, my thing is on. Okay. Okay. Does anybody want to talk about what they're currently doing for their patient feedback or customer feedback? No? Okay.
We did a customer feedback.
Okay, go ahead. Talk to us about that.
Yeah, so this is really enlightening, Michael. Reaching the patients, getting surveys from them is a lot more complicated than getting a provider survey back. So we recently had our first ever client feedback. We wanted to see how happy our clients are with our services in total. We asked them 10 different questions. Most of them were related to how responsive is your account manager, are you happy with our response times? There will always be issues. So if there's an issue, do you, and we asked them to rate it in a scale of 1 to 5, and honestly, like you were saying it in the beginning, most of them, the detractors, are more vocal. It's difficult to get because they take you for granted. If you provide good service, they're happy. They won't say a good thing. So we reached out to it. It was a very eye-opening survey for us because if a client is with you for a very long time, you tend to become complacent and you feel that hey, things are really good, but you need to catch the dissatisfaction very early in the cycle. And we, to our surprise, we found that some of our clients who've been with us for a very long time, they were getting bothered with a few things. So it really helped us address the issues right away. So we did two things. Those who gave us good reviews and good feedback, we asked them for some testimonials, and so we could put it on our website. And those who were in the middle, obviously we didn't do much, but those who were detractors, we proactively reached out to them, and we came back with an action plan to address any concerns they had, and they really appreciated it.
One of the great things about a survey is that your clients are going to hear from your detractors.
Yes.
And over time, they may not hear a lot all at once, but over time they hear something.
They keep adding up.
Eventually, they start to feel like, well, there must be something there.
Yeah.
Because they're not hearing the balancing.
Sure. Yeah.
And so if you're doing surveys and you can bring back to them and show them the positives that don't spend the time talking to them, then you're at least able to balance the perspective they're getting from the detractors.
Understood. I mean, I feel your patient survey model is very, very useful for larger group practices who have administrators who can think out of the box. We really want to we'll reach out to you. We'll probably be interested in doing something with you on a reseller basis on that. I'll talk to my part because I think it's a tremendous value add to the practices. And if we take the initiative and provide it to them, some of them will understand the value of the money they're spending.
Yeah, and I think that's an important key is this initiative that you take.
Yes.
To go in and say, these are the 3 ways that we could help you better if we had this data, or ways that you could help yourselves if you had this information. So I think that's what makes it powerful. You were talking about doing your own survey. We've acquired several billing companies, and we actually make it a practice that during due diligence, we survey the clients of the prospective acquisition.
Yes.
And it is very telling to us whether it looks like these clients are really happy and they're going to stay forever even after the acquisition, or if they're all at risk. And it can be a determining factor on the interest in the company.
Of course. So I'm sure you get pushback from your prospective targets.
It's interesting because you can quickly tell how much confidence they have in their own client relationships.
Absolutely.
If they say no, we don't want to do that. But what we do is we actually send the survey from them, as though they're they're sending the survey out.
Yeah. There's no downside to that.
And then we share the data with them, so they get the feedback just like you did when you did your survey. They get the feedback and they can see if there are areas that they want to improve.
So a lot of times, as a small billing company, you don't know really what your clients are thinking.
Yes.
If they're happy or not happy. You can do some anonymous surveys so that they're willing to put out a more candid statement.
We did. Ours was fully anonymous. Yeah. They didn't have to disclose who they are.
And sometimes, when you're a small company, you're working long hours, you get this feeling that maybe I don't even want to know what they're going to say.
Yeah.
But unless you do the survey and you get the feedback, you don't have a way of focusing your efforts to improve the relationship.
Yep.
By getting that feedback. Now, you don't have to shotgun your approach to fixing things. you can target it to specific areas.
It's also true that there is a psychological impact to participating in a survey. If somebody who's servicing me, whether it's a doctor and I'm a patient, whether it's a billing company and I'm a doctor, if they're coming to me and asking my opinion, that means something to me. I actually feel valued. I feel like they care. And so there's a psychological impact immediately. And we tell our clients all the time, it's a two-step psychological impact. Step one is just ask them, what do they think? That's the survey, right? You're getting their opinion. People love that. It has a great impact on them. The second is tell them that you listened. Find a way to show them, whether it's, hey, we recently surveyed and we found that we need to do a better job of X, Y, Z. And so we're implementing this new program. Watch for it next month. We think it will help with X, Y, Z. Holy cow, now the psychological impact is they really listen. Yeah. They really care. Yes. And we actually go so far as to say with many of our clients, I tell them all the time, I say, I don't care if a decision to change something came from the survey or not. Tell the people it came from the survey, right? So if 6 months down the road you decide to do an addition to your building or you're changing something, tell people, you know what, in the survey we heard your voice, you said this, and so we decided to make a change. And that creates, again, this kind of circle of feedback that makes the patients, the customers feel really good that their concerns were heard. So maybe that was something that was in the planning a year ago before the survey was even done, but by tying it back to the survey, it builds the psychological impact that we really do listen, we really want your feedback. And actually what you see is for places where you have repeat customers, you see the response rate go up. People are more willing to take the survey because they now see that you take it seriously, that it actually is going to be impactful. So people will be more willing to provide results. Because sometimes people, surveys take time, whether it's paper, phone, electronic, whatever the means, it's easy to avoid. But if you show them that it's valuable to you and that you're going to use the information to help them, then they become more willing to participate.
Quick question I have.
Yes.
What is the level of that you ask? You give them acquire when you do the due diligence, you go ahead and try to do a survey of the potential customers. Right? What is the amount of detail that you go ahead and ask them? Is there something that you might be willing to share to just give us an idea of how you're going about it? Because that's a good point when we ask our customers too.
We use about a 20.
Is he asking about the patients or
I think he's asking about the doctors.
The other physician practices.
Yeah, so I think the survey we use to do that historically, I think it's about 25 questions, and it has some questions about responsiveness of account management. It has some questions about collections and actual production, how well they're performing. Then there are a couple of questions about services. That's one of the things we ask is, are there services that you want them to be providing that they're not? And we actually give a list and allow them to say, I wish they offered me satisfaction surveys, or I wish they offered me more software services, or whatever it is. We can actually gain a lot of information there. But it's a variety of questions. We do ask typically, how likely are you to still be using this particular service 6 months and 12 months from now?
Yep.
And then we ask, what factor might make you consider changing billing companies?
Right.
And those two questions are very telling as well.
Also, one of them which we did, the last question was, how likely are you to recommend us to your colleagues and friends? The answer there itself tells you how happy they are with you. And was that Ramesh who asked the question?
Yes, it is Ramesh. And if there's a way you can share them, I really would appreciate some of the things that you have.
Yeah, so we can. I can email you our survey. This is the first time I did, and trust me, it was really, really eye-opening for us. We just, considering we've been around for so long, we never did it.
Yeah.
So I'll email you our actual. For the first time around, I think keep it short to about 10 questions max, maybe. I'm trying to remember whether we did 7 or 10. Actually, my partner did that initiative, and we have it. So we'll be happy to send it over to you.
I'd appreciate it. Thank you.
Okay. And I actually use, for my clients, I use something called getfeedback.com, where I just send out the one question: how likely are you to refer us to our clients? And it's very indicative of, where they're at. Are they promoters? Are they detractors? Are they neutrals? You use them as references when they're the promoters. And so I think that's awesome.
It's an interesting website, getfeedback.com.
Getfeedback.com, yeah.
Okay.
And you can build your own survey, and it's free up to 20 responses. So,
Right.
but that's more customer. It's not so much patient. It's really for like your end customer.
Yeah, there are several of those types of surveys. SurveyMonkey is another one that offers free surveys.
I think we use SurveyMonkey, or I'm trying to remember how.
Right, but those surveys are not going to give you that kind of reporting that you have where it's integrated with your software. That's like a whole other level.
It is, and I think if you're looking at doing something with just your clients, you could certainly use any tool to gather 30 surveys from 30 practices or 100 or however many practices you have. But when you start talking about a practice doing surveys for the patients and the type of value add you want to give them. You want something that's a little bit more robust that can't be easily replaced. And so you want the data, the analytics, you want to be able to go in and sort by payer. Those are things that you're going to want to be able to do so that you can help them use that data in contracting and, hospital relations and a lot of other things.
Right. Can you talk, Michael, a little bit about the intelligence behind how do you design your question? Get responses, and also that
we are 3 minutes over our time, so I don't want to, but yes, you can answer it quickly. And then I just want to, because I want to be sensitive to everybody's time. So on the topic of surveys, Practice Max would like to know if we can share your email address with them. So if anybody wants to opt out of getting an email from Practice Max with a survey, please send me a message and let me know if you'd like to opt out. And Michael, you can answer that question quickly, but first I just want to say, if anybody has any topics or anything they want to talk about that they think is relevant, that they would find value in having at our next mastermind, because we're always thinking ahead and planning ahead, please let us know. Sean's going to do one on, go ahead, Sean, give us a preview of next one.
Yeah, no, we can present something to the effect that what you should be doing to increase the stickiness of a client, which Michael also touched, like survey being one of it. We can share with you what we do to enhance our customer service experience, provide more services at less cost to the providers, and basically, being creative about the topic would be how to increase the stickiness of your client, and
so as soon as we have a date, we'll shoot that out to you so everyone can sign up. But if there is something else that's on your mind that you're thinking about, please reach out to me, send me an email. You all know how to get in touch with me. And I'm going to hand it over to Michael. He's going to
I can't even remember the question.
Well, so sometimes getting responses a little bit about how do you design.
Oh, sure. Yeah. So design. So we have in-house. We have researchers. We've got PhD level researchers that help construct the questions. We don't need to go into a lot of detail, but it allows us to test the question, make sure that they're valid, that they're not asking multiple subjects, et cetera, to make sure that what we're getting is really valid information that can be used both in correlation analysis and in general interpretation of the data.
Okay. And we have suggested topics on marketing in today's environment. Okay. We will take all that under advisement. Thank you, everybody, for joining us. Sorry that we went 5 minutes late. We'll see you again probably in January, because I don't know that we'll have anything in December. But thank you all, and we will see you soon.
Thank you, Hani, and everyone.
Okay, bye-bye.
Right. Good job, honey. It's not easy to get everybody together and keep them engaged.
Okay.
Yeah, I wonder, sometimes I
So
think,
I will have a couple of
There's an
large
option to
internal
promote the
practices. They
attendee.
get it,
Yeah.
how to keep patients happy. This is good.
Yeah, good.
Okay.
I
what
think
is-
sometimes when you ask billing
And-
companies.
Yeah, I know.